Hi there, and thanks for joining us. I'm Connie Tran. Community Medical Centers provides a full continuum of care to its patients, including home health and palliative care. On any given day, community nurses are visiting hundreds of patients in their homes, offering an alternative to frequent and prolonged hospital stays. Since the coronavirus crisis hit, many patients have been homebound and unable to go out and get food. Community recognized the need and teamed up with the Central California Food Bank to deliver boxes of food to these patients.
Loaded in this semi-truck is 750 boxes filled with non-perishable food. The boxes were donated by the Central California Food Bank. Katie Zenovich is the Senior Vice President of Development and External Affairs at Community Medical Centers. She explains.
When we needed it, they stepped up. As this pandemic started, I reached out to our Director of Home Health and said, what about our healthcare workers that are going into the homes? Any given day, we have 750 to 800 patients in the home that are being cared for by community. That's a whole other hospital outside of our walls.
Community teamed up with the food bank in March, right around the time the COVID-19 pandemic hit, and many were forced to shelter in place. Community nurses noticed some of their patients, who are often the most vulnerable, couldn't leave their homes to go grocery shopping or get food.
Hello.
So why not bring the donated food from the food bank to them?
It's nice to see their appreciation, their smiles, knowing that, today, tomorrow, they're going to have something good to eat, and it feels good.
Leslie Flores is a registered nurse who cares for patients in their own homes.
When patients are discharged from the hospital, they still have needs. We educate families on how to administer IVs, do wound care, trach care, peg care. Infants, when they're discharged from NICU, we usually, are home with them, learning peg feeding, trach care.
Leslie has been with the home health department for the last 8 years and says this new task of delivering food to families who need it is an added perk to her job.
Can you imagine being critically ill or having some other disability that makes you homebound, and you have no idea how you're going to access your next meal? And here your nurse, who you know and trust, comes into your home and provides that helping hand and that food at a time that you need it the most.
Kim Dildine is the co-CEO of the Central California Food Bank. She says when Katie reached out to them to partner up for the betterment of the community, it was a no-brainer to help. Kim says since the pandemic hit, the need for food has skyrocketed in the Central Valley.
We know that 1 in 4 people in our community struggle with hunger on a daily basis pre-COVID. We were serving on average 70,000 households, or 280,000 individuals every single month. When COVID hit, we saw a 50 to 100% increase across our distributions, 25% of which had never accessed the emergency food system before.
Every day, 30 to 40 food bank volunteers load up the boxes that will be given to home health nurses to go out to patients in need.
We really focus on high quality, nutritious food to go into this box. These boxes include canned vegetables, fruit, breakfast items like oatmeal and muffin mix.
What this does is it makes sure that they are nourished, they have groceries. We want them to be healthy and well, and the one way to do that is to provide good food for them. And that's where the food bank stepped up and helped us out.
So far, more than 1,200 boxes have been given to communities' patients across the valley by Community's home health nurses. It's a partnership Community and the food bank hope to continue.
Thank you, guys.